Well, the fight against COVID-19 is stepping up globally, with every measure being put in place to stop the spread of the virus. With the involvement of more doctors and health workers as volunteers, Nigeria is not leaving any stone unturned. And as the index case in the country continues to rise, curtailing the spread becomes more challenging and, of course, very ingenious. This is why a young Nigerian doctor with a wealth of experience in healthcare has developed a special walk-in COVID-19 testing booth that can save many lives. Joining me now is Doctor Ola Brown, a Nigerian UK-trained medical doctor who is perhaps best known for her entrepreneurial efforts as the founder of Flying Doctors Nigeria. Good to have you join me this hour, Dr. Ola Brown.
Hi, nice to be here.
And before I start, I must commend you for the most impressive development I have seen during this pandemic in Nigeria, a glass box testing center. You couldn't be more ingenious. How were you able to design this?
I'll tell the truth. I saw them using it in South Korea, and I thought, we could adapt it to Nigeria using local materials. So we got a group of designers together. Obviously, the first few models that we did went completely wrong. So the first few times we tried it, it wasn't that ingenious at all. Either the pressure wasn't right, the temperature wasn't right, the compartment wasn't right. But eventually, we got to our final model, which was acceptable. So I think that it's less of genius and more of looking at what's going on outside Nigeria in countries that have managed the epidemic well, and then trying to adapt it to something that can be produced locally with local materials.
Well, how long did it take for the box to be designed, and how capital intensive was it?
So it took about just over 2 weeks of a lot of work and a lot of redesigns and a lot of sketches for it to be designed. And in terms of capital, again, because I told you we had a few, maybe 2, 3 that went completely wrong, it was quite capital intensive to bring out the final design to the specifications that we wanted. But we had a very, very good team who was resilient and kept on trying. Different materials, different different ideas, putting it together and then looking and taking advice and looking where it had been done in the world. We also saw a model from Brigham General Hospital I think it's in Boston, where they'd also designed something like this. So we looked at what they had done as well and brought some of the ideas together to make the final product.
Now, we understand this glass box testing center is in Ogun State. Where exactly in Ogun State? Is it accessible, and why did you choose Ogun State?
Well, it's in Ogun State and it's in Otta. And I think what the government wanted was, because Lagos is the epicenter and Lagos State has the most cases, what they wanted to do was, a lot of people that work in Lagos actually live in Ogun State. So you have a huge number of people traversing that border on a daily basis. Either they're coming home from work in Lagos, or they have 1 or 2 things to do in Lagos, and then they're going back to Ogun State. So there's a fusion of people in those border areas. So they chose one of those border areas specifically because of its proximity to Lagos.
And is it an Ogun State government initiative or a public-private partnership?
It's an initiative of Ogun State. All I did was provide the innovation side, and they're providing the service. And the advantage, I guess, of the service is it prevents health workers from having to have direct contact with the patient. So for me, I'm always thinking about the welfare of healthcare workers, our lab scientists, our nurses, our doctors. And the reason why I felt like it was so important to try and protect them is because I was scared. I was scared by the numbers that I saw in Italy. I was scared by the numbers I saw in Spain, where you saw, according to some statistics that I've seen online, up to 10% of healthcare workers get ill. I'd seen the statistics of, our Nigerian doctors in the diaspora, in the UK, in America. sorry, I said in America, young doctors that I know that have caught the disease and been very, very ill. And I'm not talking about weak, like 80-year-old doctors. I'm talking about young 35-year-old doctors that go to the gym every day, that drink smoothies every minute, were becoming significantly ill, and some of them losing their lives. So anything that could put a barrier between healthcare workers and potentially infected patients was something that I wanted to make sure happens. And in addition to this, why it's so different, the picture is so different in Europe and America compared to Nigeria, is because they have a lot more health professionals. So if you look at the number of doctors for every 100,000, every 1,000 people, there's 4.2 for every 100,000 people in Europe, up to 4.2, whereas there's 0.37 here. So again, we need to really, really protect our front line because we have so much fewer in terms of numbers.
Indeed, and we seem to be having a spike in community transmission. How much will this glass box testing center help?
So in terms of community transmission, I think that the main strategy now for testing is really testing in people's local communities and making sure that testing is more accessible. The testing booth allows people to come to a certain place that is known, get tested in a sort of local environment, and protects the healthcare worker. But apart from protecting the healthcare worker also, I don't think people know this, but a cost of the full PPE with the boots can be up to 40, even 50,000 naira, and you have to change it with every new patient. But when the healthcare worker is inside the booth, then there's less of a requirement to change PPE all the time because obviously they're not coming in direct contact with the patient. So instead of, you can imagine, over 100 patients at up to 50,000 naira, 40,000 naira per outfit. You can imagine how much you would have spent in a day if you were changing between patients. But in the box, you're saving money by saving cost potentially on PPE, but you're also saving lives of the healthcare workers, which we don't have that many of, and we really need to protect them from getting the disease because they are sort of last line of resistance against this virus. And if Nigeria starts losing healthcare workers or healthcare workers start getting infected at the same rate as we see in Europe, then, you know, our healthcare system would be teetering on the brink of collapse.
Indeed, and the NDC has complained of a shortage with testing kits. How long does it take for results of the test from this glass box to come out?
So I think that, you know, there's a global shortage of these testing materials, and everybody really needs to club together with their influence to be able to make sure that we have these testing materials, both the reagents and the primers and the sample kits and even the molecular labs to do the testing. So I think it's super important. It's becoming a bottleneck in the system. So I think it's important that we speak to our NGO partners and everybody really gets on board to help us procure this material, because it's not I think that anybody, either private sector, public sector, third sector, NGOs, can really use their influence to try and get these materials, because these are the materials that everybody in the world wants. So really, we're negotiating with companies that want to supply to America and the UK, countries that are willing to pay 3 times the price, 4 times the price that we can afford. So it's really important for us to use all of our diplomatic channels to try and acquire these materials. In terms of the turnaround time, it really depends on the availability of materials and the number of samples in the lab. So I can't really speak for the laboratory operations because we're not involved in that. But I do know, like you mentioned in your question, that there is a shortage of these materials. Right now, we have about 10,000 sampling kits, but sampling kits are not the only part of the equation. We can take the samples with our sampling kits, we can store them in the viral transport medium, but we also need primers and reagents to be able to process the samples in the molecular labs. And these are the things that I think the DG of the NCDC was saying that are in short supply right now.
Exactly. So is this testing both consistent with the molecular testing type that the NCDC DG was insisting on?
Oh, so there's 2 different things. The booth is to collect the sample. The samples are now transported to the molecular lab for testing. So this just makes this process of sample taking safer, and then they're transported to a lab. And that's why I said that the turnaround time really depends on the capacity of the laboratory and the provision of materials, like you mentioned. That's really important, because the testing kits we have, so the sample taking kits we have, but what about the reagents and the primers that are used within the lab to process these results, the sort of extraction materials, etc. It's quite a complex process. So we need to use all the diplomatic channels that we have to try and get these materials and try and, like, you know, ask the big countries to make some space for Africa.
All right, now, Dr. Ola Brown, founder of Flying Doctors, I can't thank you more for joining me on Arise Africa this afternoon.
Thank you.